let's dissect the glenohumeral joint capsules a little bit more. Let's go after the posterior glenohumeral joint capsule. So we're going to set up and go through, take you through some strategies, show you some techniques that we can go to feed in and feed out. Take up the slack in one plane, mobilize in the other planes to see where we can find our success to give us more internal rotation. We're going to play around with distance, direction, and heights of anchor points. We're going to use the right upper extremity as the upper extremity of our focal point with regards to corrective exercise technique, performance enhancement, rehab. The posterior glenohumeral joint capsule responsible for enabling and facilitating internal rotation as well as the rest of our posterior cuff. So we can look at the supraspinatus, the infraspinatus, the teres minor, the teres major, the latissimus dorsi. We can look at the axillary space and its defining and boundaries as we have kind of this diamond-like structure that's formed in the armpits with the serratus anterior, twisting and winding on through. It's important that we take a look at why we're having the limitations perhaps in internal rotation. So we're digging into and going after our thoracic spine, taking a look at our type 1 and our type 2 in sync and out of sync motion. We're looking at our scapulothoracic joint mobility and our hip mobility, stability throughout the lower extremity, and taking a look at the reaction that we get in the transformational zones that are specifically functional to the individual, scratching our heads as to why, and taking a look at maybe why we're having some of these pathological related type issues with the joint capsule and the meshing of these tendinous-like structures of the rotator cuff in amongst that joint capsule, as well as the other fascial potential restrictions that are there as well. So posterior glenohumeral joint capsule, digging into and taking a look at some strategies with regards to fixations of the upper extremity, taking a look at why we don't get the internal rotation that we need to, implementing, devising some strategies with both our upper and lower extremity that we can help create more internal rotation and more sustainable internal rotation at the right glenohumeral joint capsule.